Okay, so this is the trauma patient assessment for a school age patient. So this recording is for clinicals. So the first step in this scale is putting on proper PPE, which is gloves. And we have been called to a scene in a playground where a 9-year-old female fell from a slide 5 feet high right on her shoulder. So she has a dislocated shoulder. So that's what we have been told. So when we arrive at the scene, I will begin my scene size up. So I will first make sure that my scene is safe. I will determine the mechanism of injury, which is a fall from a slide 5 feet high right on the shoulder. So we have a dislocated shoulder, or the patient has a right dislocated shoulder. And then I will determine if the number of patients I only have one patient. I will not request additional EMS assistance, and I will not consider C-spine because when I arrive, the patient seems to be sitting fine, and the only injuries is to the patient's shoulder. I'll now begin my primary assessment, so I will state the general impression of the patient. So we have a 9-year-old female weighing about 90 pounds that's holding her right shoulder in pain because she fell on it. She's sitting on the ground in the playground with her parents. Everything else seems to be normal. There seems to be no additional injuries or life threats. I will now determine the level of consciousness. So our patient is alert, and I will now determine the chief complaint, either talking to the patient or their parents. So hello, my name is Dina, and we are EMT today. What happened?
I fell off the slide and it went on my shoulder.
Okay. So that's why the patient called, because they fell from a slide. That's the chief complaint. I will now begin my ABCs. So first is the airway. So because the patient was talking, the airway is open. I will now assess the pulse and breathing at the same time. So I'm going to assess the pulse through the radial artery and the respirations by looking at chest rise and fall. Okay, so after I have done that, the patient has a pulse of 92 beats per minute and respirations of 22 breaths per minute. The patient is getting enough oxygen, and I will not initiate any oxygen therapy. And I did check the pulse. There seems to be no major bleeding to be controlled. I will now assess the patient's skin color. So as we can see, the patient's skin color is pink, warm, and dry. And I will make a priority. So this patient is low priority because there are no life threats currently. I will now begin my history taking. So first, I will talk to the parents regarding the patient's sample. So I will ask if the patient has any allergies. The patient's not allergic to anything. They're not taking any medication. They don't have any significant or relevant past medical history. Their last meal was a cheeseburger with soda, and the events that occurred is the patient fell from a slide 5 feet high. I will now begin my OPQRST. So the onset is the patient falling from the slide. I will now ask the patient, does anything make the pain feel better?
No.
No? Okay, and can you describe the pain?
It's like pressure on my shoulder.
Okay, and I will now ask the patient if it spreads anywhere. Does the pain spread anywhere?
No.
Okay, and on a scale of 1 to 10, 1 being no pain at all, and 10 being the most pain you've ever felt in your life, where would you rate this?
A 6.
A 6? Okay, and I'll ask the parents or the patient when this happened, which was 10 minutes ago. I will now take vital signs. So the blood pressure is 106/67. Their pulse is 92, and their breath is 22 breaths per minute. I will now begin my secondary assessment. So because the patient's only injuries on the shoulder, I'm only going to assess that extremity. So I'm gonna feel for any deformities. Of course, there is a dislocated shoulder. I will now assess the patient's pulse, motor, and sensation function. So I'm gonna assess the patient's pulse. Can you wiggle your fingers for me? Okay, and which finger am I touching?
The middle finger.
Okay, and now I will immobilize the patient's shoulder so there is no movement to cause further damage. So I will splint it using the sling and sway technique, and you want to put his hand down. And I will splint it by using the minimum movement of the hands. And I will pad the patient's neck, but I wouldn't do that in that situation because there's no need. But if, of course, I'm using a different material, I would pad the patient. So I will make sure that the patient's arm is resting on it, and I will now immobilize the shoulder by attaching the patient's limb to their torso. Do you mind if you scoot forward, please? Thank you. So I'm gonna make sure it's tight enough and the limb secure. I will now assess pulse, motor, and sensation once again. So I'm feeling for the pulse. Okay, can you look at your fingers, please? And which finger am I touching?
The middle finger.
Okay, so now that I have fixed any injuries in the patient from our secondary assessment, our final step is to make sure that we reassess, transport the patient, of course, and reassess the patient every 15 minutes by redoing the primary assessment, retaking the vital signs, and I will provide an accurate verbal report to the receiving hospital. And that's it for my patient.